Good evening, and thank you for tuning in tonight. I'm New York City Councilman Chaim, and you're listening to Chaim on the radio on 620 a.m. I'm joined tonight by my co-host, Dr. Faye Zakheim, and we're filling in for Werzberger here on Talkline Communications Network. Welcome, Faye.
Hi, Councilman. I am so happy to be on the show tonight. This has been a very, very challenging week, and I was just looking forward to being on the show because I figured I would find a lot of comfort in just hearing you talk about all the things that are going on. So thank you so much for allowing me to co-host.
Yeah, unfortunately this week we have to speak about COVID again. And if you remember back in March, we had March and April and even into May, we've almost every radio show was we spoke about COVID-19 here in New York City and the challenges that many people have gone through here in New York City. So at the end of last week's show, we spoke about the rise in COVID cases in New York City very briefly. And at the time, I had mentioned that I invited Department of Health to join us in the show and answer questions, but they were unable to accommodate last week, Thursday. So this week, I'm happy to report that New York City Health Department Deputy Commissioner Dr. Demetre Daskalakis has agreed to join us tonight, and Dr. Demetre has been on the show before and back at the start of the pandemic in March. And we are pleased to have him join us again tonight, both as an expert in disease control and as a leading health official in New York City. Doctor, thank you for joining us. We've put together some questions based on feedback from our listeners and inquiries that have come up into my office in the last several weeks. So we're going to dive right into it. So welcome.
Great. Thank you so much for having me. It's a pleasure to be on again.
Yeah, thank you very much. So let's get right into it. We spoke about, and you've been hearing the news about the zip codes throughout the city that have the highest spikes. Let's first, can you tell the listeners of which zip codes they're referring to and what boroughs those zip codes represent?
Sure. So I'll tell you that we are seeing 4 clusters of increased COVID-19 activity in New York City. 2 of the clusters are in Brooklyn, and 2 of them are in Queens. So I'll start with Brooklyn. We've given the clusters names just so we can speak about them easily. One we're calling the South Brooklyn cluster, and that is, as its name would imply, in southern Brooklyn, and includes several zip codes. Would you like me to actually list the zip codes out?
Yeah, that's fine. Yeah.
Sure. So it's a little bit of a list, so I'll do it. So 11213, 11225, 11226, 11218, 11219, 11204, 11203, 11210, 11223, 11229, 11234, 11214, and 11235. So a pretty large chunk of southern Brooklyn. A few of those zip codes have a higher percent positivity than the others. So the cluster, that area all in all, is experiencing a percent positivity around 4%, and the zip codes that are included in the cluster about a little bit over 3%. So that's what we're calling the South Brooklyn cluster. There is also a Northern Brooklyn cluster that we're calling the Williamsburg cluster, and that one includes 11211, 11249, 11205, and 11206. That cluster is showing a percent positivity of around 5.5%. And just for point of reference, the citywide percent positivity is a little bit over 1%. So definitely seeing exactly a higher percent positivity. The other 2 clusters are in Queens. The first one we're going to call Central Queens, and I will again read out the zip codes: 11374, 11375, 11367, 11415, 11435, 11432, 11365, and 11366. and the percent positivity in that central Queens cluster is around 2.5%. And then finally, we have 11691 in Far Rockaway, and that is experiencing a percent positivity of about 6.5%. So I'll just go over them in a different way quickly. So the Southern Brooklyn cluster that we talked about, its weekly number of cases is about 1.5 times that we're seeing in the city, and it has 1.8 times more cases in this area versus 2 weeks ago. The Williamsburg cluster, it actually has a rate of about 3 times what we're seeing in the city, and has 2.1 times more cases in the area than 2 weeks ago. That Central Queens cluster, 1.7 times citywide, and 1.6 times more cases than 2 weeks ago. And then finally, Far Rockaway has a weekly case rate about 4 times greater than the rest of the city, and actually has a little bit fewer cases this week than it had in the past 2 weeks.
Mm-hmm.
So that in totality is what we're seeing in terms of these areas that are demonstrating more disease activity.
Uh-huh. You know, we had back in March, I believe March and April was like the peak of the pandemic. And throughout the summer, we haven't heard too much about it. The numbers went down. And now we're starting to see an increase of cases of COVID. And, you know, many people believe that the virus has evolved and is no longer as life-threatening. So can you explain to our listeners why that's not true? And can you speak about the increasing hospitalizations throughout the
Sure. So I think our best lesson for why it's not true that there's mutations is what we're seeing throughout the rest of the country that experience resurgence as well as other areas of the world. So I think that we are still seeing areas that have cases followed by hospitalizations, and then some people will have more severe outcomes. So there is no convincing data that there is any mutation in the virus that's making it weaker. I think, you know, what's important is that we're in a very different position than we were last time that we talked. So I think I spoke to you in March,
mm-hmm.
and at that point we had very limited testing because of the fact that you know the tests that were delivered to us from the federal government didn't work. There wasn't a lot of access to testing at that point because it was pretty much a restricted, a very limited resource. Now we're in an era where we do have testing. And what that means is that, you know, in March, we really had to wait for hospitalizations to actually see what was going on because we didn't have tests to tell us that people who weren't that sick actually had infection. So now that we do have testing, we actually have an earlier signal than hospitalizations, which is that the tests go up. So I think we have an opportunity to prevent a surge of hospitalization like what we saw in March, by sort of really doing the things that we did to bring the pandemic under better control, such as wearing masks and washing hands and avoiding large gatherings, creating distance of greater than 6 feet, and then and staying home if people were sick. And now on top of that, testing. So what is important is we don't have a giant signal yet of people being admitted to the hospital, but we definitely are seeing increases throughout the city of increased hospitalization. It's not at surge level, but that's something that we want to prevent because by the time that we see a surge in hospitalization, that means that the cat's out of the bag.
Okay, I think Dr. Fay has a question.
I have a question. Yeah, I would love to ask a question. I was actually on the radio show when you were on. It's Dr. Fay.
I remember. Nice to hear your voice again.
Yeah, hi. I know, I'm recognizing your voice as well. So I loved being on the show with you back in March, and I certainly didn't think that this was going to be happening in October. I just didn't think so. But let me ask you, I'm really curious about this. Like right now, with people getting it, yeah? So they're kind of getting it. Some people are going into the hospital, but they're going in, they're coming out. I'm just wondering, like, is this COVID, like now at this point, considered like the flu? Is this what we should be thinking of it as? Because when people get the flu, there are people that die of the flu as well. but we're not in frantic mode. And right now, the mental health of people is just catastrophic. Like, I'm seeing really normal people they're losing it. They're on medication, they're depressed, they're anxious. So I'm just wondering, is the new COVID more like a flu? Or can we start thinking of it in that kind of way?
Well, so first I'll say that mental health is really important, and it's really important that, to sort of seek out help if you need it. So I think that bringing that up is really, really important. So thanks for bringing that up. I mean, as a doctor seeing patients, I've definitely seen some of my folks who have never been depressed in their lives coming in being depressed and anxious because of COVID. So I echo the importance of mental health during all this. So thank you for bringing that up. But yeah, I think we really can't take it for granted that COVID is going to be like the flu. Remember, the flu, like you said, is deadly to many, many people nationally. Like in a bad flu season, we could have like tens of thousands of deaths. But what we're seeing with COVID still is that, it's not come to that point where we can have sort of the complacency that it's going to be like another cold or a flu. Because we've seen what happens when it's unleashed in its full sort of wrath onto the city and other parts of the country, in the world. So I think, we're not quite to the point where I can tell you it's like flu. And the other part that, is important is that we don't have any way to prevent it, like from the perspective of a vaccine or a medicine. So, many people who get the flu, even if they've been vaccinated, will have a milder course of illness. So I hope that when we're at a point where we have a vaccine, I can come on the show again and say, yeah, this is like the flu now. We have a vaccine. We have other things that can help. And so we're in a place where it's similar. But I think that since we're still, dealing with all that we can deal to prevent transmission, which is, again, all those, the masking, the hand washing, and all that, I think that we have to treat it with a lot of respect that it can still potentially cause a big toll on our city and our loved ones.
So Dr. Demetre, originally, we had school closures, both in public and private school. I have a D75 school, a special ed school, and they were closed because they had 2 or more cases. And originally it was the numbers were 4% for school to be asked to close. And then the administration came down saying if there's 2 cases, that would be enough to close the school up. So I have a few questions. Number one, based on the flu, like when children have a flu, they're in school, and there's more than 2 cases or there's 4%, we don't close down the school, right? Mm-hmm. The school doesn't get closed down. Oh, there's a flu going around the school. That's the first question. The second question is when you have a school with 500 children and 2 cases, you have 2 cases of COVID within the school, and then the city comes in and closes down an entire school, sending home 500 children. Now, 2 weeks later, you may reopen the schools by saying, okay, we quarantine for 2 weeks, you could come back. But when the administration sends 500 children home, right, what do the kids do at home? They play with their friends, they go to the neighbors, they go out to the park, they walk out on the street, so they're not really as protected as if they would be in a school environment with guidelines where the Department of Health said that the schools were doing a great job. The problem is that they had 2 cases or more. So don't you think, or do you think that I think that it's more beneficial for schools to be open on the guidelines, and this way it's a controlled environment while the kids are in school, and then when they get home, they do the homework and they go to bed. They eat supper, they do the homework and go to bed. And now the kids are at home.
So I'll start with the flu question, which is, I think it goes back to the earlier question about is COVID like the flu, and it really right now it isn't. And so I think that during a regular flu season, we don't close the school for a couple of reasons. The kids often have a more indolent course, which is also not untrue for COVID, but just because the stakes for COVID are higher, given the mortality rate is so much higher than a regular flu. So the standards, the public health standards to protect the public health are a lot more stringent. for COVID than for flu. Now, again, when we have a vaccine that works and treatments that are available, like that will be a different dialogue. So I think that we're not there yet to be able to sort of have that comfort with COVID to say, well, we're going to keep a school open even potentially in an outbreak. It's sort of like thinking about what happens with pandemic flu. So you remember even during H1N1, which compared to COVID was a very mild disease, we still were closing schools because of outbreaks of that flu because we didn't really know very much about like how sick people would get from the virus. So whenever you have a scenario that's new like this, you tend to have more stringent standards than you would for viruses that you already know about and have other measures like vaccines and treatments to treat and prevent. In terms of school closures, I think that the goal that we have, I think, citywide is to get kids in school and keep them in school. That's the goal. But I think, especially in the setting of COVID, we have to be as careful as possible because schools are again congregate settings, like places where people gather, and there's potentially risk for transmission. So I think that we know from the first round of COVID when it first happened in March that really we think that school closures were at least one of the measures that limited the potential of even greater transmission. So I think that taking a conservative stance on schools to make sure that we are trying to keep schools open as best we can, but also if we're seeing transmission that is concerning, to make sure that we do prevent a venue where folks can transmit is critical. So I think I think New York is of all jurisdictions in the country, I think one of the most aggressive in trying to reopen schools, and I think that is our guiding principle. But also the need for safety in the scenario that you do have a potential outbreak or small cluster in the school.
All right, I think that's okay. I hear what you're saying, but I still don't agree on all the the way the city comes out with the metrics and when to close a school or not. We're going to have some doctors on the phone. I speak to infectious disease doctors every week, and we have different conversations about issues happening here in the city. But let me ask you, if someone has COVID, or you take another scenario if someone was exposed to someone that has COVID. So the city always says, okay, you need to quarantine, you need to isolate. I don't think people know the difference between isolating and quarantining. And that's the first question. Like, can you explain to the listeners when should someone quarantine and when does someone need to isolate? And also, what resources does the city have available for people that are either in quarantine or in isolation?
Great. So I'll tell you that no one should feel surprised that people don't know the difference between isolation and quarantine. I think that many medical professionals don't know the exact difference because people will use the words interchangeably, and it's incorrect. So I'm happy you asked that. So isolation is what you do if you're sick. So an individual who has who has COVID, they're supposed to isolate. That means to stay at home and try their best to stay away from people for at least 10 days since the onset of their symptoms, or 10 days since the day they got their test if they're asymptomatic. Isolation continues for at least 10 days, and people have to have no fever and improvement of symptoms for at least 24 hours before they leave their home. So that's isolation. So isolation is for people with disease. Quarantine is for people who have been exposed. So that means that people who are close contacts. So I'll remind you that a close contact, there's a lot of sort of caveats, but the main definition is being closer to someone than 6 feet away for more than 10 minutes who has COVID. But there are other scenarios that could also be included as a close contact. And an example is if we're considering students in a classroom with someone with COVID, a close contact, as an example. So quarantine is very similar in terms of what your directions are to do. You're supposed to stay home. You're supposed to only leave for essential medical services. And the difference is that it's for 14 days since the last exposure to the person with COVID. So it's a bit longer. And in terms of resources, I think if you look at the Test and Trace Core website, they have the part of the program that's called Take Care offers lots of resources to people who are isolated or quarantined.
No, the reason, Dr. Demetre, the reason why I'm asking about the resources is very simple because, in many people in the community, they have, they have large families. You could have a family and they have 8 children and they live in a 2 or 3 bedroom apartment. So when you're asking, when someone is infected with COVID and they're being asked to isolate, how is it possible for a family to isolate in a 2 or 3 bedroom apartment when there's so many people living there? So, based on that, what does the city have to offer? And that's the reason why I'm asking.
Yeah, that's great. Yeah, so it's the Take Care service that's associated with the Test and Trace Court actually includes the option of hoteling. So individuals who aren't able to isolate or quarantine safely at home are able to get a hotel free of charge for the duration of their isolation and quarantine. And so that's actually part of what happens when the tracers give you a call. If you're a case or a contact, they actually assess your ability to stay safely at home, and then if you're not able to, they offer you a hotel as an option. And for those who are able to stay safely at home, they offer the ability to get, either medications delivered if you need them or food delivered. So they try to sort of create a sort of wraparound sort of package of services that can help people actually stay home rather than leave. But I'd love to also talk about some myths, since we're talking about clarifying the difference between isolation and quarantine. I think another one that I'd love to talk about is herd immunity. I bet you're going to ask me about it too.
That was
yeah. Do you mind if so this is my favorite myth to talk about.
Yes, tell us. I'm dying to hear. Yeah.
Yeah, no, it's so herd immunity is the idea that if enough people have been previously exposed to an infection and then have immunity, then that protects the community from more people getting the infection and spread. So it's very similar to the idea of what happens with some other vaccine preventable diseases, that if you have enough people vaccinated, that protects the entire community. So there, I think, are a lot of myths flying around that certain neighborhoods, certain areas have had enough infection. They have enough antibodies, which is what we always hear, that there may not be, that they've achieved herd immunity. And so the part that's really clear is, we're seeing in areas of the city that have high percentage of people with evidence of exposure to COVID because of antibody tests, actually having a higher rate of infection. So there's a lot of scientific debate about what percentage of the population needs to have had COVID before we achieve this herd immunity. And I think that from the perspective of what we're seeing in the ground in real life, it's certainly not any percentage that we've achieved in New York City, since we're seeing ongoing transmission. So I think a lot of folks all over the city have a belief that the sort of fact that they were in a previously an area that has had a lot of disease, that they're somehow protected by that immunity, that sort of this community immunity, but it's not panning out so far. And so I think that is a myth. And so if we can help dispel that would be amazing, because I think antibodies aren't a replacement for the community to sort of continue wearing masks and washing their hands and avoiding large gatherings. So I think we have really we're seeing it with our own eyes rather than having a scientific debate, that some areas with the highest percent positivity on serology are still experiencing a really significant number of infections.
So, Dr. Demetre, I have a couple of questions. I'm so grateful for this. Chaim, thank you so much for this show, Councilman Deitch. It's amazing. So one of my questions is really exactly what you're saying. So the fact when people walk around and say, "Oh, it's okay, you can stand next to me, I have antibodies," that's not true. It's a myth.
Well, so,
they're not safer just because they have antibodies.
we think that being exposed to COVID and having antibodies does confer some amount of immunity for some amount of time, but we don't know how strong that immunity is, and we don't know how long it lasts. And so, antibodies don't replace the core four is my slogan. And the core four are the things they keep harping on, which is the mask wearing, the hand washing, the keeping distance between people, and staying home if you're sick. So, I think there is a little evidence that reinfection occurs, so we have some evidence of that. But then also, we don't have that level of immunity in the community to make us feel comfortable that it's okay to not do that mask wearing and all the other important things that we know prevent COVID.
Okay, and now I have another question.
I would say antibodies or no, you should wear a mask next to people.
So I've been really lucky. I'm one of the people who managed to get out of the city, so I'm living the life of a hermit for the past 6 months, and I've been okay because I'm social distancing and I'm masking all the time. But this weekend, I'm actually having my mother come and visit, and she's also healthy, also hasn't had COVID, and I'm having a couple of my children. It's going to be, let's say, about 6 of us in the house. If we're wearing masks and there's social distancing in the house, is that okay as well, or does that social distancing and masks only work when you're outdoors?
So, no matter where you are, indoor or outdoors, the best defense we have against COVID is really is space in the masking. So I think no matter where you are, if you are doing that, you are creating the maximally safe environment you can. You're limiting the size of your gathering. It sounds like it's not a lot of people, which is also really important. And I would also say that, it's not unreasonable to think about folks getting tested if they're coming together for the first time, 2 or 3 days before they come together. The good news is, in the city, the turnaround time for testing is fantastic. It's some of the best in the country again. So it would be, it's not 100%, insurance policy, but if everybody is negative before they go and they're wearing masks and they're socially distancing, you're doing everything that's maximally possible to prevent the infection, indoors or outdoors.
But when, let's say if they're coming for the weekend, right? When are they supposed to get tested? Do they get swabbed on Friday and then they walk into the house and they say, I was just swabbed and I'm fine?
So if they're sick, they should stay home. That's the easy one.
No, nobody's sick. Thank goodness.
Good.
Nobody is sick.
Amazing. Good. Perfect. And so, the other idea is, a couple of days, 2 to 3 days before, if you get a test and that's negative, that should feel pretty good. Like I said, our turnaround time citywide is about 2 days now. So if people go get tested, and there are also sites in the city that are doing rapid testing or testing that turns around very quickly, including our Department of Health sites that we call the COVID Express sites in multiple clinics throughout the city. So, testing, it's not mandatory before your visit, but, if you're able to do it, that will even provide you sort of more sort of comfort that everybody there is landing without an infection. But then at the end of the day, your advice what you just asked me, the idea of masking and social distancing, even in the home, I think is a great way of preventing transmission.
Yeah, I love the rapid testing idea. One last question.
Yeah,
I have a daughter who
it's
lives
great, right? The rapid testing is amazing.
I love that idea. I'm actually going to do it because I think they could pull off the rapid testing before we get together.
Let's take the phones are ringing here in the studio off the hook, and
okay,
I just want to take at least one phone call, and also we have to take a commercial break. So let's get one caller. Hi, you're on the air.
Hi, how are you?
Hi, you're on the air.
First of all, I want to thank you. My name is Naftali Horowitz. I'm here with Tommy Stern. I want to thank you, first of all, for the opportunity and the information that you guys are providing. It's wonderful. Everything that we've spoken about so far and I've heard is talking about the COVID and how it's affecting everyone, and it certainly has, whether it's schools, businesses, every social interaction. So the best thing that we came up with, we thought of, is as we're waiting for this vaccine, we need to come up with a product. How do we prevent to be able to stay out of isolation and quarantine? So one of the things that we've thought about was the schools. And in the schools, obviously, the issue is for the children to get back as fast as they can in a safe environment. So we have an item, it's called Sit Safe. And it's a chair barrier which is something like the desk barrier, but it's one step beyond. Because the desk barrier, really, if you're just sitting in front of it or right behind it, that's all you're protected with. But unfortunately, going down the aisle or sitting next to the other student, you're not protected from the other sides. And practically speaking, 6 feet to stay apart on each direction is just not practical in this situation. So our development in the Sit Safe is a chair barrier that fits on. It's a plexiglass that comes around all three sides.
Yeah, Mr. Horowitz, thank you very much. But I'll pass on the information of Dr. Demetre, and you can speak to him directly.
Okay.
All right. So, Dr. Demetre, thank you so much. And we're running out of time. We have to take a commercial break, but I'd love to have you back another week, maybe next week, and maybe we could take some more calls. And listen to my constituents. They have many questions. The phones are literally ringing off the hook here. So, Dr. Demetre, thank you so much.
Thank you
for joining us, and let's all be safe. And we're going to take a commercial break, and when we come back, we're going to be welcoming 2 community physicians who have been at the front lines of fighting this virus since March. So we'll be right back.
Thank you.
TCN, Talk Live Network Radio, America's #1 Jewish program.
Welcome back, and you're listening to Chaim on the Radio, 620 on the AM dial. I'm here live on the air with my co-host, Dr. Chaim. We are pleased to welcome Dr. Eyal Levit and Dr. Murray Werzberger to the show tonight. Dr. Levit is a practicing dermatologist here in southern Brooklyn, and when COVID struck and hospitals became overrun, Dr. Levit sprang into action to treat his elderly patients at home and give them a higher chance of survival. And we're also joined by Dr. Werzberger, who owns a modern medical practice here in southern Brooklyn. He joined us on the show several months ago talking about his revolutionary method for treating and monitoring high-risk patients at home. And both of these doctors are heroes, and true heroes as far as I'm concerned. And I think I speak for all our listeners when I say thank you for everything you have done to save lives during this difficult time for our city and our country. So, welcome on the air.
Thank you, Chaim.
Thank you very much.
I disagree with the hero part. Each of us are just doing our duty best that we can to help our homeland and our people in our community.
Yeah, and thank you. And Dr. Werzberger, I don't know if you ever met, I don't know, Dr. Levit, if you ever met Dr. Werzberger. And
I've heard wonderful things about him, but I didn't meet him. I don't recall meeting you, Doctor.
Yeah, and
I just referred to you, that's all. Don't worry about it. I just refer to you. It's not a problem.
So it's great to have you both on, and I want to ask each of you, from your perspective, what have you seen being in the front lines and working with COVID patients? What have you seen in the front lines in regards to the spike in cases that have been reported, and what have you seen?
Dr. Levit,
I'll defer to Dr. Werzberger first.
I'll choose your fingers. We'll go.
Go ahead.
All right. I'll just say a brief, just compare, contrast, and then I'll just briefly. First of all, what was and what is, just to bring the public up to date. In March and in April, clearly we were all new. We did not know what we were doing collectively, and we were learning on the job. The hospital was the last place on earth that anybody wanted to go under all circumstances, and everything all physicians did was to try, as what Dr. Levit and myself did, was try, and other people, we worked with teams of keeping people at home, either electronically, either by going there, or whatever was needed to be done through Hatzalah, through Shomrim. It was a tremendous Kiddush Hashem. It was tremendous help, Siyata D'Shmaya, and it kept very sick people at home for a very long time. And in the community, there was medicine that was given at certain intervals that was obviously appropriate at that time. Today, right now, that is all yesterday's news, and everybody, please take it out of your head. This is the way we practice now is completely different. In the community, we still monitor for the sick patients with the cough, pneumonia, and the shortness of breath. We watch their oxygen. But it's a completely different story and a much more optimistic story. We do not watch it all the way down to 90, 80, and then send the patient to the hospital, etc. In the community, there's no medicine to give as an outpatient. no medicine. We have nothing to give. But in the hospital, for the appropriate patient, we have 3 wonderful remedies intravenously that are given for the appropriate patient. So we get the patient earlier. When the patient's oxygen is dropping down, and the patient has a fever and they're not doing well, and they have a case presentation later if there's time, and that patient gets into the hospital early and gets the medicine and less ICU days, less intubation or no intubation, and much less death, Baruch Hashem. That is what's going on in the community today as far as cases. Cases are ramping up. We are sending patients to the hospital. The patients are as sick as before. The numbers go down as before. An hour before this broadcast, I sent a patient into the hospital we've been watching for day 14. So the cases are as sick as far as on our end. Baruch Hashem, there is more to do in the hospital, and the whole story is how to keep everybody out by mask, distance, hand washing, regardless of whether you're learning, whether it's davening, whether it's hakafas, or anything else. Those rules apply all the time, every time, in home, at shul, in school, learning, in the grocery store, everywhere. We must do it, and we must do it now.
So, Doctor, let me ask you, there's a lot of naysayers out there who are saying COVID is over and people shouldn't worry about it anymore than worry about the flu. So what do you think, and what do you tell our listeners about that, based on what you just said?
So I think it's not me who should talk, but my patient who when I want to talk about, she's a 30-year-old, a 30-week, I'll get it straight, a 30-week pregnant woman, and we should all have her in our tefillos, and it's Rachel Bas Blima, and she got sick about a week and a half ago. Her family got sick, the children, the husband, and her. She called us, and we started tracking her, and within 3 days, her heart rate went up to 120, and her oxygen started dropping, 97, 95. She was tired, under the covers. We sent her they called Hatzalah, took her into Methodist Hospital where she's in the ICU as we speak. So, Baruch Hashem, she got the remedies that we talked about, and there's a case in point that it's different than before, 180 degrees different. But I was hoping to see if she could join us tonight. So I texted her and I said, we're trying to get the people to mask up. Do you think you could speak on the phone during the radio show to encourage mask? No pressure at all, or just text me a message to Klal Yisrael to help save us.
Wow.
And she answered, I can't talk because I don't have much voice, but we'll try to write something up. Thank you, that would be awesome, Yasher Koach. Her answer, and what she would like to say to Klal Yisrael. Every breath matters. Don't let COVID-19 decide when is going your last breath for you. Mask up. The cases are real. The sickness is real. It's a real disease. People are very sick. The list of rabbis, of shuls, is more than a minyan. It was probably 2 minyanim. Please understand, this is real. We are not doing enough to stop the spread, which means we are responsible for the people in the hospital. If we don't mask, if we don't wash, and we don't keep the distance, for any reason, religious or otherwise, we are promoting the disease, and we are putting my patient, Rachel Bas Blima, in the hospital. There's no other way to explain that. She's in the hospital because we did not do our job. All of us. We are not doing what must be done to slow down this disease, which means that each of us is responsible in our own way for the cholim that are going into the hospital. And they're more and more, and in the words of an infectious disease doctor very close to me, who I trust with my life, he said, we are at Purim.
Wow. I invited Dr. Levit to be on with us tonight. Dr. Levit lives in the southern part, southern Brooklyn, and he has a practice in, I believe, Manhattan Beach. And I want to hear from you, Dr. Levit, from being in the front lines, working with COVID patients and helping treat them. Tell me tell our listeners, just like Dr. Werzberger just told us, how serious this is, and people cannot take this disease for granted, and listen to the naysayers out there who's saying that, this is the same like the flu. I got a phone call this afternoon, and I had an argument with the guy. The guy was saying this is like the flu, like we don't have to wear masks. And this was not one of my constituents. It was someone from a different area. But, we have to take it seriously. So, Dr. Levit, give us your perspective of what you have seen as a second doctor we have in the air tonight on this radio show, to tell us what you have seen and what your message to our listeners is.
Well, first of all, Dr. Werzberger, Yashar Koach, he said it so eloquently and very well summarized the past, the present, and what's the future that's basically in our hands and our responsibility. One of the things that I would only add is that one of the ways that we can help reduce the spread is by realizing that this is not a taboo if you have it. This is not trying to hide if you got infected with AIDS, HIV. It doesn't mean that you did drugs. It's not necessarily directly your fault if you can still wear a mask and still get the virus. So by testing yourself, by letting other people know, please watch out. If you have any symptoms, start treatment early so you will reduce the risk of getting complication, reduce the risk of having to be hospitalized, or not only that, but reduce the risk of infecting other people in the process of walking about and trying to, they won't want to sit next to me. You are saving people's lives. So this is number one thing that I would say. Number two thing that I would say is the panic. The panic that was before with that should not be now. So extremes are never helpful. Saying that this is like the flu has a little bit of truth to it. Yes, in some people it will pass like the flu. It is a flu. But this COVID is so brilliant in a bad way. It knows exactly our weaknesses. It has adapted to find those with a genetic deficiency to fight this virus. And there are 13 chromosomes that they've found that have mutations in them that predispose you to have more severe disease. And I don't want to, confuse people in going into the details of it, but there is something called interferon, which interferes with the virus' ability to enter. And they found that more men than women have a mutation, those who have the severe disease, have a mutation in this interferon. And what they do is they actually attack their own defense system and not allowing the body to fight the virus. So since we don't know who of us is more susceptible, we need to be very, very seriously concerned and watchful. And so while your caller has some reason to say that it is like the flu, this is not like any other flu. And we've seen it by the number of deaths that were outside. Nobody made it up. This is real stuff. And as for what I've seen in our community, the problem is, I have to admit, and Dr. Werzberger said it so brilliantly, that we're all at fault. I can tell you that my level of vigilance has waned. It is very difficult to constantly stay at high alert, staying at home, staying outside of the restaurants, finally coming out, wanting to hug everyone that you haven't seen for such a long time, and yet having to realize that you don't know if you may be worsening the situation by trying to come too close to them. And when they start seeing the numbers wane, they thought that the situation is okay and you don't have to wear a mask. And so you can say that two camps have formed. And we're talking about brilliant people making those decisions. And when you start doing that, you are breaking the laws of the infection control and predisposing people to get sick with the corona. And unfortunately, nowadays, also people are dying. The reason they're dying, like Dr. Werzberger said, is because they're trying to not treat themselves, think that it's nothing, and by the time they come into the hospital, it may be too late to, reverse the cytokine storm that causes their lungs.
And I think,
stop functioning.
And the bottom line is, everyone needs to work together. The naysayers and the sayers, whatever you want to call them, everyone needs to work together. You know, if you're not going to do it for yourself, do it for others, protect others. And if you're not going to do it for yourself or for other people, guess what? Do it for your children and your grandchildren, because schools are being closed up with 2 or more cases, public and private schools. I have a few public schools in my district. One has already been closed up, and the second one has already 1 case. And you know, all they need is 1 more case, 2 cases, they close up an entire school. And the only way we're going to get through this is if everyone's going to mask up. And, you know, people are unsure, you know, if you have to wear a mask outside. And I could tell you, when I'm walking on the streets, people constantly walk over to me and talk to me. And at times I have people come over to me, they're not wearing a mask. And I said, I'm not interested in talking to you until you put on a mask. Right? So, you know, so the theory is that when I'm walking outside, I don't have to wear a mask. But yes, you do have to wear a mask as long as you're going to be, you might be within 6 feet of others. I know it's not easy to wear a mask, but you need to mask up. When you're walking into a supermarket, into a store, you need to mask up. When you get home, make sure you wash your hands with soap and water, warm water. And social distancing is extremely important. You know, when you're in the house of worships, whether you're even in the supermarket, try to stay as far away from others as possible. And I know that's difficult, and people are. We spoke before about immunity, and I'm hoping that people are not going to be immune to social distance from others once this virus goes away. But we have another, literally like 2 minutes left. So I just want to hear a final message, like 1 minute from each, just to our listeners.
If I may, first of all, I agree with everything, and thank you. I agree with the doctor was excellent. The upcoming events, somehow we think that our religious events will not cause problems, and there's nothing further from the truth. We have cases where Rosh Hashanah spread it within the community in the shul. We have Yom Kippur, it brought cases to people in the shul. We have a Yontif coming up. We must protect our community from thinking that the virus will not spread. Hakafas and shul, mask and distance. If you're going to do hakafas in the shul, it's going to be a very different hakafas. Mask and distance, everybody, all hakafas. And the aliyahs have to be thought out that there's mask and distance. Mask and distance. I'll say it for 2 minutes. Mask and distance. Whether it's Simchas Torah, whether it's in your sukkah, wherever it is, hakafas and the whole aliyahs and kol hanarim cannot be. It's usher to be as it has been in the past. It is pikuach nefesh. It's pikuach am Yisrael.
Thank you very much, Dr. Werzberger, and it's really been an honor to work with you. I just want to end up with Rabbi Levit to give a final message. We only have like 1 minute left.
Wonderful.
I would just say that you can be a carrier even if you have immunity. So those who were sick and think that they don't have to wear a mask, they need to wear the mask to protect others who didn't get it. Number one. Number two, those who had the disease before, they think they have antibodies, so they won't get sick. I've seen people sick 1 month within that. I've seen people with high antibody titers getting sick again later. They won't get sick as badly, in my personal experience, but they will get sick. So this, having had the disease before, will not prevent you from having the disease again, and will not prevent you from spreading it. So again, the masking, the hand washing, not touching your mask afterwards, not playing around with it, removing it from the rubber band, all those are really key features.
Thank you very much, Dr. Levit, Dr. Werzberger. Thank you so much, and I want to wish everyone a happy Yontif and a great Shabbos. And I want to thank everyone, our guests tonight, for being on and for educating our listeners. So until next week, have a great Shabbos and enjoy your Sukkot and stay safe. Thank you.
Have a great Shabbos. Happy holidays.